Hello, everyone, and thank you all again for joining the Diane Goldman Kemper and Robin Kemper MS Wellness Seminar. Our speaker for this evening is Dr. Sarah Mulukutla. She is a board-certified neurologist and the founder of the section of Neurohealth and Integrative Neurology at the American Academy of Neurology. Dr. Mulukutla is also the founder of Mindful Neurology, which is a clinic focused on mind-body connection, yoga, and neuroplasticity to improve treatment and recovery from neurologic disease. She has been studying meditation and how it affects the brain for many years. Her passions are meditation, yoga, and the impact of thoughts. With pleasure, I present Dr. Sarah Mulukutla.
Thank you for the kind introduction. I'm going to start with a personal story. But yes, I'm a neurologist. I'm really passionate about yoga and mind-body medicine, but I've also been a patient. When I was 24, I found myself suddenly very ill with chronic migraine. And it was 8 years until I became headache-free. So my story has a happy ending, but what I'm hoping today to talk about is that anybody who has, even if there is a diagnosis of disease, we can still be well and feel well. And mindset has so much to do with it. And I'm going to be talking about that. I also chose this topic. It's near and dear to my heart. I shared that story because I know that many people with MS get diagnosed with a condition in that time frame, young adulthood. And I guess no matter when one receives the diagnosis, it's terrifying and life-changing. I can empathize with this young kind of peak of what you think is young adulthood, getting a diagnosis. And in my clinic, I see people who are 20 years into the disease, but still haven't come to grips with it. Sometimes they cry about, when they talk about the MS, we carry our illness with us. And what I want to show you today is that if we can find some resources and techniques, and I hope to share some today that resonate with the audience, we can feel healthy and resilient. And resilience is the key of living a purposeful, engaged, meaningful, joyful, having a very high quality of life, even in the face of disease. And I'm going to share some techniques today. I'm not sure how familiar you are with the literature on MS and depression and anxiety. So one might be what we call the psychosocial factor, this concept of getting diagnosed with a disease. That's terrifying. That leaves someone on immune suppression, which comes with other anxious thoughts. But there's also a really strong connection between depression and inflammation. I was just at a conference in Boston where they presented that up to 5 years before diagnosis of MS, many people with MS start to experience depression. And we think that's largely because of the inflammatory markers, the same ones that are related to multiple sclerosis, actually cause depression. I have a couple slides on this. Also, the location of where some inflammatory lesions in the brain, that can also be a real trigger for depression. Altered gut biome, which we know is prevalent also in multiple sclerosis, can lead to depression. Pain and fatigue, some comorbidities of multiple sclerosis, high rate of experiencing depression if these are not well controlled. But what I want to switch to is not the science of what's wrong, but some of the science that shows how this can be overcome. So this is a really neat study that I found years ago that showed that stress management for multiple sclerosis, when patients were enrolled in a clinical trial of having counseling, one-to-one counseling, over a 6-month period, the group that received the counseling developed less lesions on MRI, just by being engaged in a relationship to help deal with stress. So 6 months in, 24 weeks in, 85% of them remained lesion-free. And the group that didn't get the counseling, that's the red group down there, that number dropped to 60, only 60%. So there was a pretty big difference. But as soon as that counseling was stopped, that's what's most interesting about that. The two groups normalized. So what we see is that what we need are lifelong skills to manage emotions and depression. And this is another study that shows that treatment of depression in people with multiple sclerosis actually had a reduction in the inflammatory markers. When you actually treat the emotional factors that are under there, or at least address it, you can control inflammation. This is one example of how mindfulness has shown to benefit the immune system. So this is a group of subjects that were randomized, and when they, after participating in 8 weeks of meditation, they showed a very robust, an increased response to the flu vaccination. But there's a couple other studies on mindfulness that show that after people learn stress management techniques, their ability to secrete anti-inflammatory cytokines actually increases as well. But I'd like to take some time and read actually this resiliency scale. This is a multiple sclerosis resiliency scale, and it's divided into 5 categories. Number 1 is emotional and cognitive strategies. 2, physical activity and diet. So paying attention to what one eats and how one moves. The presence of MS peer support. Support from family and friends, which was found to be separate from a multiple sclerosis community. And 5, spirituality. These are 5 domains that when people can cultivate this aspect of their life, they are more resilient against depression and subsequently have increased protection against inflammatory activity. There's many ways to work on mindset. And part of this process is starting to become familiar when one thinks that there isn't a presence of anxiety and depression, and being committed to work on it. And there's many ways that I hope to talk about it. These are resources that I want to have available for everybody, but there's some really excellent toolkits online called the My MS Toolkit. So when I pull up this toolkit, they also hit on many of these key principles, but you have to be structured and you have to be committed to improving your own health. A lot of it has to do with mindset, but for example, there's a whole module on getting started. So that's a great place to start. But I love that the next one is goal setting, because that's really becomes your weekly planner. There's a great weekly planner that I can share, but basically every week you look back and you say, what worked, you track daily, but on a week is a great time to assess what worked last week. What do I need to change? What are my health goals for this week? So goal setting. I'm going to click on the managing emotions for starters. There's some tools, but there's also a worksheet. They guide you through step by step. For example, that really strong study that showed that when you start managing your own stress, you can affect your MS. This guides you on a few of the strategies to try, and you have a worksheet that you can print out. First, you identify your triggers. So in the beginning, you just collect data. You're just kind of observing and paying attention to this. You have your sheet with you next to your bedside or in your living room or in your bag. When you notice yourself getting stressed out, you write it down, you evaluate your response, and then at some point later, when you have time to think and reflect, you choose a new plan. I'm going to guide you through meditation because meditation helps with all these steps. So this is one example of how you might work with emotions from this toolkit. So I talk a little bit about the relaxation. So this guides you on, again, a way to evaluate your symptoms that's going on, how it relates to your relaxations, and to make a plan. And that's really the step. You work on it day by day. Choose one thing to work on at a time. If you're committed to it, you will succeed. Can Do Society is another organization dedicated to MS quality of life and has great resources on managing stress, as well as webinars, topics, readings, blogs that may be of interest. On this slide of resources, I also have a link to a depression screening where you can go online and you can fill it out and you can see if you meet the criteria for depression. That may lead you to take this a little bit more seriously or not, because oftentimes we don't know where we fall. All of us have anxious thoughts. All of us have mood swings. How do we know where the cutoff is, what needs a little bit more help? So here's a questionnaire that you can fill it out, and it calculates your total score and it gives you the criteria to take a look at it. And it's the same thing for an anxiety screen. There's one more questionnaire that I thought would be really helpful. It's a questionnaire for sleep apnea. I was reading some studies that the relationship of obstructive sleep apnea is higher than we understand in MS, and that could really interfere with sleep, and it could certainly cause depression, fatigue, head fog. And that's what I look at in my role when I help people evaluate lifestyle. It's trying to really pick apart what are the possible easy to treat areas. Becoming informed is going to automatically motivate you. Once you learn something, you won't be able to unlearn it, and that will be a huge motivating factor. So back to this issue of how do you actually get there? So yes, you have to be committed to it, persistent, stay with it, flexible, track, get your own data. And this is a range of some different avenues to pursue. And as you can see in the cognitive behavioral therapy, I'm also happy to share that article so you can talk about what categories they used. But this is what came to mind with me. So there's psychotherapy, you can do one-on-one counseling, cognitive behavioral therapy. Medication would be with a psychiatrist or an MD to prescribe medication, and that was shown to work as well. Social connections, meditation, yoga, relaxation, exercise, all of these are shown to reduce depression. One has to think about what's the low-hanging fruit in your own life. What do you need the most? And what is easy to fix first? Because what you want to do is take small steps and see gains in both your physical and mental health. So this is an example of our thoughts in our brain, right? So we think that they're ethereal and that they just exist in the ether and inside our head. But every time we have a thought, certain parts of our brain are activated. In meditation, you sit quietly and you try to catch yourself thinking. And when you observe your thoughts, that thinking network calms down. It's like it got caught. And that's what this slide shows. The top slide, so I'll explain what I'm looking at. So this is a copy of, this is an image of a brain, which we see on MRI. You have two hemispheres in the brain, and the image all the way on the left shows immediately down the middle. So if you take the two brains and cut it like this is what it looks like. And this middle area is where a lot of the emotions are processed. That's the emotional cortex in our brain, right midline. The middle slide is looking front to back. It's like you're looking from the top or looking from the bottom. Again, you see it's a midline. It happens a lot in the middle, but you also see that it's centered a lot in the front. So the front is where we're planning our story of ourselves, like what you're planning your future. It's where your to-do list is being generated. You're planning your visioning, kind of what you want your life to look like. On this last image on the right, you have your memory center. That's what H is up there. You have your insula, which has a lot to do with kind of body awareness and also emotional processing. So in brief, your network that's running all the time is your story of yourself, who you are, where you are in space and time, your executive planning for the future, your memories, and your emotional centers. And this is a network, meaning these are areas of the brain that are very deeply linked and always active. And this is why our thoughts can jump from one topic to another, because we have such deep connection between our memories, our emotions, and our frontal executive centers, planning of the self. When you start to meditate, you catch yourself thinking and two things happen. First, suddenly you become aware of this dialogue that's running and you realize how often you're having the same ruminative thought. And it happens to all of us. Secondly, you learn to stop that thought just by practicing catching it. And then you get space to change your thought. You decide, I don't want to be having the same negative thought over and over again, and you do something about it. And that's how meditation gives you an empowerment from your own sense of awareness to change your behavior and to change your thought. And it changes your brain. So in 2000, they started to show that when you start a meditation practice, you change the neural networks in your brain. You change your thoughts, you change your neural networks. Also change your inflammatory profile. You change your endocrine, your hormones. You change everything. It's really powerful. Thanks so much, guys.